yesterday, and we anticipate those rates to be maintained and to increase today. And I want to thank our health detectives for doing some amazing work overnight. Dr. Chant will be able to provide some more information, but our health detectives have been able to locate the original source of the infection and the likely way or potential way that it may have been transmitted, and I'll ask Dr. Chant to comment about that. Overnight, in addition to the one case we spoke about yesterday, the man in his 50s, his wife has now been tested positive as well. The balance of his close contacts are negative. So whilst, of course, we remain on high alert, pleasingly at this stage, nobody else has been identified as being a positive case, but we know that the incubation period of this virus is 14 days, and so everybody has to be on high alert moving forward, especially over the next few days. As a precautionary measure, the New South Wales Government, based on health advice, will be taking the following measures which will be enforceable from 5 p.m. today. However, we do ask everybody to start doing these things from now, but obviously we want to give people some time. So from 5 o'clock today, we ask that you welcome no more than 20 people into your home, and these restrictions or some measures will be in place until Monday morning, midnight Monday morning. So essentially for 5 o'clock today, Friday, Saturday, Sunday, we ask that nobody welcome more than 20 people into your home. We know that transmission in the family home is a high risk. And I appreciate that it's Mother's Day, but we also appreciate that 20 people within the home is manageable for people to celebrate that important day. There'll be no singing or dancing in indoor venues. This includes places of worship and obviously entertainment venues. The exception is weddings. We recommend that only 20 people at a time be on the dance floor, but outside of weddings, there'll be no singing in congregations, no dancing, apart from obviously the performers in a show. In relation to mask wearing at indoor places will be compulsory for the next 3 days. Public transport, if you're going to the supermarket, any indoor event will require compulsory mask wearing, in addition to hospitality workers and people serving you. So obviously you can go and have a meal, you can go and enjoy a hospitality venue, but the workers will be expected to wear a mask for the next 3 days. In addition to that, we also want to make sure that people are just sensible. Make sure you maintain your good social distancing, make sure you avoid large events if you're vulnerable, and make sure you exhibit good hand hygiene. And most importantly, make sure if you have the mildest of symptoms, you come forward and get tested, or if you're deemed to be a close contact, that you not only get tested but stay isolated and await health advice during that incubation period. And what is really critical to all of us in New South Wales is to make sure that we're on alert. The measures I've just spoken about will only be relevant for Greater Sydney area, so Central Coast, Greater Sydney and down to the Illawarra. So anyone outside of those areas is business as usual, but as a precautionary measure, we'll be putting in these restrictions over the next 3 days. But as you know, we've not affected the number of people that can be at a venue. We've not touched the square metre rule or anything like that. But what we are doing as a precaution is saying if you're catching public transport, if you're at an indoor event, indoor venue, please wear a mask. And of course, for aged care workers, it means only 2 visitors, and it also means mask wearing, especially to protect the most vulnerable. We believe this is a proportionate response to the risk we have ahead of us. I do want to thank in particular this couple who exercised and used their QR codes, and we cannot tell you how useful the QR codes were in relation to identifying people who may have been at various venues or identifying close contacts. The QR codes is what is allowing New South Wales to have a proportionate response, in addition to, of course, the wonderful work done by our health detectives. So just to reiterate, over the next 3 days, there will be compulsory mask wearing, household visitors will be limited to 20, no singing or dancing indoors, but for weddings where we recommend no more than 20 on the dance floor at any given time. And I should also add that as a precaution, we're recommending that if anybody is going to a bar, that all drinking indoors be seated. So as an extra precaution, over the next 3 days, if you're going to a bar, get your drink, but sit down instead of mingling to prevent any potential transmission. So I just want to thank again for people adhering to the advice. We know that when we do give advice, people adopt a common sense approach. We know when we do give advice that people respect that. And again, I'm asking for our citizens, especially in that Greater Sydney area, Central Coast, Sydney and down to the Illawarra, to take these measures on board. They come into effect from 5 p.m. today and will last until Monday midnight Monday morning. However, we do ask that between now and then you adopt them. We appreciate some people are already at work, and we appreciate that people have already made decisions for the day. We will be enforcing this from 5 o'clock. However, we do recommend, if you're in a position to be able to adopt these changes from now, from upon hearing of them and learning of them, please make sure you do that. We've been very careful not to impact unnecessarily businesses and others who might have already made arrangements over the weekend, but we do ask citizens and workers to be extra cautious and to adopt that compulsory mask wearing. I'll now ask Dr. Chant to disclose some of the good work the health team has been doing in relation to the virus, and then Minister Hazzard will also make some remarks regarding the health orders and how important it is for people to comply and how important it is for everybody to use your QR codes. And if you're a business, we will be having extra compliance officers to make sure QR codes are readily displayed, people understand what is COVID safe in that venue, to keep all of us safe. Thank you.
Thank you, Premier. So New South Wales recorded the 2 locally acquired cases of COVID, and I'll go into more detail about those cases, but there were also 9 new cases were acquired overseas to 8 p.m. last night, and 1 previously reported case has been excluded, bringing the total number of cases to 5,327. There were 11,579 tests in the period. Now, if I just now take you through the cases, so just to recap, we announced yesterday there was a gentleman in his 50s that had come back as a locally acquired case of COVID. Testing of close contacts, there were approximately 10 close contacts of the case. 1 household contact has come back as positive, but the 9 other close contacts have come back as negative overnight. The person who came back, the household contact who came back as positive, had a very, very high CT value yesterday, and that shows that person is in the early phases, or it could be the end phase, but today the person has cooperated and got for another test and we thank that person greatly for that cooperation, and that's shown that her infectious level has actually increased. So that means that we've picked up that person very early in the infection, which is consistent. In terms of the contact tracing, we have reached out to the venues that we indicated yesterday afternoon, and then we added a number of other venues last night, and they were related to the movements of the subsequent household contact. And I want to express my gratitude for everyone in taking those calls from public health, responding to that text messaging and getting tested. In terms of the detective work about how this case acquired, so in the absence of genomic, it was actually quite hard because we didn't have any lines of inquiry. This person had not come in contact with a quarantine or border workers, and so the genomics was pivotal. And can I just thank the work of the lab yesterday in doing that work, both across the ICPMR and also the SEALS laboratory assisted with some of the other tests related to this case. But what it showed is that the sequence from our new case matched with an overseas case who had travelled from the US and went to the Park Royal at Darling Harbour. The person was tested on day 1 and was positive and was moved to the SHAR, the Sydney Health Accommodation, on the 28th of the 4th. We are exploring any, currently reviewing CCTV footage to look at whether how the transmission got from this individual to this to our case. And what we're concerned about is that there's a missing link, that there is someone that, because there is no direct contact that we've been able to establish yet between the case. As you can imagine, there's strict procedures around the person being admitted to in the quarantine facility and then transferred to our health quarantine facility. We can't find any direct link between our case. So what we're concerned about is that there is another person that is yet unidentified that infected our case. And then the hypothesis is that our case then passed it on to the household, which is what we would believe because of the greater risk in households. What we've also identified is because this person arrived on the 26th of the 4th, it really allows us to narrow down the time that our case was exposed. So usually we have to go back that full 14 days, but because of the link to the genomics, we now know that he was most likely even, taking those sequence of infections around that end of April. And so that's allowed us to identify some additional venues today where we're asking people to go out and get tested and isolate. And these are venues that he attended in that, not whilst infectious, but we are trying to find if there is a source of infection at those places. And that relates to the Fratelli Fresh at Westfield, Sydney, and F5 Pitt Street on Tuesday the 27th of April at 1:15 to 2:15, and at Bondi Beach, the Bondi Trattoria, on 34 Campbell Parade on Thursday the 29th between 12:45pm and 1:30pm. And as you'd be aware, those dates precede when we believe the gentleman was infectious, which was from the 30th of April. So can I thank everyone for their cooperation? Obviously, as I said, we have also had the Marrickville sewage test positive, and we can't find an obvious source for that. Now, obviously, people do move around, but given this concern about the local transmission, it has made us even more heightened in our concern about sewage detections. So the catchment serves about 42,000 people and takes sewage from the following suburbs: Dulwich Hill, Marrickville, Summerhill, Lewisham, Ashfield, Haberfield, Petersham, Lilyfield and Leichhardt. And while my message is to anyone with the most minimal of symptoms, please come forward and get tested, we're particularly calling out those suburbs because of that detection. We will be repeating the testing, and we are trying to bring forward any tests in the Sydney area to assist us in establishing the extent and scale of any transmission that we're currently missing. Thank you.
Thanks, Kerry. Look, first of all, this is a nasty virus that does not show any respect for humankind. But first of all, this couple have done everything absolutely the right way. I've been advised that there has been some criticisms of this couple. I want to stress to the community that it could be any one of us next who could get this virus. It is a virus that is prepared to get to any one of us at any time, and that's a very unfortunate reality of a 1 in 100 year pandemic. I want to thank this couple publicly for doing everything that any one of us should do. And that is, they were using the QR codes that we've been talking about now for more than a year. And that has allowed our incredible health detectives to do their work during the night. It's been another terrible night for health and for the health detectives, the tracers, but they've done their work. So I think we need to understand that respect to this couple should be appropriate, and respect to anybody who comes forward and uses the QR codes should be given freely and happily. And I want to, as Health Minister, say thank you to them. And I hope all of us would be in the same situation if we happen to have this virus come to us. I also want to say the response today has obviously been very urgent. There's been lots of work done during the night by our health officials to give advice to the government on what steps we should take. I would ask the community to listen carefully to any further advice, because as it progresses, we may need to change parts of that advice. At the moment, it has been an advice that tries to respect our rights as individuals to move around, but also to keep our broader community safe. It is a proportional response, but it's proportional to what we know at this present time. Finally, I'd like to say this. This is a very salutary reminder that this extremely dangerous virus requires us to get vaccinated as soon as we are in the categories that we are entitled to have that vaccine. Any reluctance to get vaccinated should be right out the door now that you've heard we have yet more cases here in Sydney. As we get our opportunity to get vaccinated, go and get vaccinated. Take your medical advice. In the first instance, go and talk to your GPs. Your GP knows you. If you don't have a GP, get a GP, because that will be our community, our family safeguard, and of course our individual safeguards. Get the vaccine as soon as it is available. Thank you.
Premier, your announcements here and your restrictions are going to infuriate people across this state. Why have you gone so hard so fast? Why are you applying a Palaszczuk-McGowan response to 2 cases?
Oh, this is nothing like that. It's extremely proportionate. Everybody will be able to get around their business. All we're
They
saying...
can't sing anymore, they can't dance anymore, they've got to wear masks everywhere. Why
Well,
go so far, so hard?
Well, it's not in outdoor settings, it's in indoor settings. And as we've heard, as Dr. Chant said, it's been amazing that our health experts have identified who we believe was the original source of the infection. But what we also know is that at least one person with the virus has been going around their business and we haven't found them yet. We don't know where they've been. We don't know if they've been to major events. We don't know who they've sat next to. So what we know for sure is that someone with the virus has been moving around the community and doesn't know they have it. And they may have then infected many other people. So all we're doing is a very precautionary response over the next 3 days. It's actually very proportionate. Unlike other premiers, we're not shutting down the city. We're not changing the 2 square metre rule. Quite the contrary. We're saying to everybody, business as usual, but just do a few things extra to make sure that until we identify those cases, or at least one person, it could be more, but we haven't yet established how the virus got from the original overseas traveller to the patient we identified yesterday. So until you know that, and until you draw that down, we know that at least one person has been going about their business, potentially going shopping, attending events, going to family gatherings. We don't know. So until we do know that, and until we know that there aren't more cases that are going to pop up, it's a very proportionate response. In fact, in other states, they would have locked down the whole city. They would have closed businesses. They would have stopped events. They would have said you can't dance at weddings. We're not doing any of that. This is a very proportionate response to the risk. If we had been able to identify the case in between, the missing link or links, of course we would have taken a different approach. But we know for a fact that there's at least one person, if not more, walking around with the virus, not knowing they have it, or potentially having attended many events and venues. And that's why it's important for us to have the proportionate response. People can still enjoy Mother's Day. They can go about their business. Outdoors, you can do pretty much what you do now. But if you're in an indoor setting, just know that that's high risk. If you're in an indoor setting, wear a mask. If you're going to the supermarket, wear a mask. These are just precautionary measures until our health experts find some more information.
This fear message that you're projecting now will see cancellations in restaurants on Mother's Day across the city. And why on earth include the Blue Mountains and Wollongong?
Well, as we've known previously, people commute between these locations. We saw last time...
Everywhere.
I remember last time people said to me, why are you including the Illawarra? And then we had cases pop up in the Illawarra. I mean, last time we were told, why are you including Illawarra? And the next day there was a handful of people in the Illawarra. This is about making sure we keep our economy open, keep our jobs going. It's a very proportionate response over the weekend. In public transport, until recently, people were wearing masks anyway. And what we have to accept is, whilst the pandemic is here, from time to time we're going to have to revert to some, what I call in this regard, light touch measures. If this was WA or Queensland, they would have shut down the whole city. They would have said stay at home. They would have said don't go about your business. We're saying the opposite. We're saying go about your normal business, enjoy Mother's Day, enjoy what you do normally, just take that extra bit of care. And the main bit of care is in relation to mask wearing, and the main bit of care is also in relation to how many people you welcome to your home, because we know that's high risk. These are just basic things that you would do to make sure that we don't cause a super spreading event. In 2 days on the northern beaches, we had 80 or 90 cases because of a super spreading event. We're not saying don't have those events. We're not saying don't go to venues which have the 2 square metre rule. What we're saying is, please know there's a risk out there. We haven't identified the person, at least one, could be more, who are walking around with the virus. We don't know where they've been. We don't know what family gatherings they've been to, where they work, what job they have. We don't know any of that. And until we do, it's highly appropriate to take this proportionate response. In fact, I'm sure all the other premiers will be criticising me for not going hard enough.
Are you concerned business is going to cop a hit, Premier, a big hit, over this Mother's Day weekend because of these restrictions.
Why?
Because there will be cancellations.
Why?
People will be
No.
scared of going out about their business because of these restrictions.
Why? We're not suggesting that for a second. We're saying if you've got a booking, go to the booking. Enjoy Mother's Day. Do what you would normally do. This is actually the opposite approach. We're actually saying to businesses, keep your doors open, just make sure your COVID-safe plan.
You aren't just saying in the wording, it is strongly recommended the community avoids mingling in large groups over the coming days. There are 6 NRL games scheduled for the Greater Sydney region. Should those games go ahead?
Well, look, they're outdoor events, and absolutely they should go ahead. Outdoor events, but there's. Can I stress again? Outdoor events, outdoor gatherings are very low risk. What we are doing is in relation to indoor gatherings, which are higher risk. And I'm happy to be criticised. I'm happy for people to always question what we do. But the strongest message we're sending is to business. It's business as usual for businesses. It is business as usual. The only difference is that your workers should wear a mask, and from time to time we'll be asking them to do that. We're in the middle of a pandemic. What happens if tomorrow we find 20 cases? Then people will say we haven't gone hard enough. What happens if on Monday we find 10 cases? They'll say we haven't gone hard enough. I stand by our decision. It's based on health advice. It's proportionate. And can I repeat, if this was Queensland or WA or anywhere else, they would have shut down the whole city. They would have shut down businesses. We are saying the opposite. Business as usual.
Just on indoor events, there's obviously Hamilton's on, Frozen's
Yeah.
on. What's the message with those large gatherings?
The message is do what you do. When I went to Hamilton, we all wore a mask. It's the same thing. It's business as usual. You go to an event indoors, wear a mask. When I went to Hamilton, the cast and crew obviously performed brilliantly, and all of us in the audience were wearing a mask. This is no different.
Do you have a working hypothesis on how it has escaped? I know you said you haven't figured out exactly, but do you have an understanding of what might have happened?
No, and I think that's why we're acting sort of precautionary. And can I just stress that what we're asking people to do is apply for common sense. We've told, we know that indoor environments are more risky, but the risk is still very low. And with the cooperation of the community, we're hoping every day to get better intelligence. This is a proportionate, measured response of just requesting it. So I would urge everyone to enjoy Mother's Day. The precautions we've put in place will protect everyone. But the key messages are, please don't go to Mother's Day if you've got COVID symptoms. Get tested. So there's nothing really changed, and people just need to know that there is this risk, and we just don't know the full extent of the risk. We're just taking a precautionate approach, and that will declare itself in the next 3 days as we test individuals, and we will update the community about that risk.
So are you concerned that people in the hotel quarantine system or healthcare workers, they could be the missing link, and there's a number that work in there that are now in the community spreading it?
So look, we're not speculating on the numbers, but at the moment we haven't got a direct contact established between a person who was infected with this overseas person who's returned traveller. Sorry, and we have checked our Oceania database, and this is the only matching sequence. We've always got to keep an open mind, and I've always said that. But our best available scientific evidence is that this person is presumably the source of the infection. So therefore, we are also looking at whether we're keeping an open mind, because we are also looking at whether how common this sequence is in other travellers. But given we test flight crew, given we test our returning travellers and do that genome sequencing, we're feeling that this is the most probable source of the infection. We don't know how the infection then got from this individual into this other person, and so therefore we are obviously concerned there is an intermediary.
But it's not
And
one
that-
staff member, because you're testing staff every day, right, in the hotel quarantine system and the special health accommodation system. So has there been any?
So obviously the aspects of the investigation we're undertaking is following up all of the staff. As you're aware, we undertake the salivary testing program, but if staff are absent you're not working every day in that program, and so we are following up staff who work there to get a test. So we're exploring all avenues for including reviewing the CCTV footage for the whole train of how this individual came in through our borders and entered our quarantine system and departed to the Sydney Health Accommodation.
Regarding the strain, you mentioned that the original source is a man for a person from the US. Is the strain US or from somewhere else?
It's a particular variant under investigation, so it's not a variant of concern. It's an Indian variant, and I'll give you I do not want to mislead you with the numbers, but it's B11. But I will get you that information. It's an Indian variant under investigation. It isn't listed as a variant of concern at this point, but obviously we're watchful of all of these as we get more information.
Dr. Chan, in regards to yesterday, you said that there were 13,500 tests. Today we've seen around 11,500. Given that the message got out yesterday afternoon, you would expect to see a spike, certainly today, in the number of people coming forward for testing. Do you think it's likely we'll see more numbers tomorrow?
Look, I would be hopeful. As you are aware, we report the tests when we have the negative tests reported into our system. So even the testing numbers we will monitor from overnight and hopefully see a large number today. But I would urge the community that we do not want to put restrictions on the community for any minute longer than they need to be. This is a proportionate set of response to actually just minimise that super spreading event with these unknowns that exist. But as we get further information over the next couple of days, we're hoping that we can really ascertain that missing link and determine that we've tracked down any chains of transmission.
Can everybody just be a bit calm today, please?
So we've got venues in the eastern suburbs, we've now got venues on the northern beaches in the western suburbs. I mean, has the extent of this man's travel concerned you, and if so, how much?
Can I just say that I think it's really important that the person, a number of those venues are lower risk venues. The fact of the extent of the travel, the fact that people do QR codes, I'm less worried about the extent of the travel, but whether we've got good details of where they are. I would also like to extend my appreciation to many of those shops, because what the greatest risk in some of those settings is actually salespeople who are directly interacting. When you go to a number of those venues, you don't actually intermingle with other guests, whereas for me, hospitality venues where you have larger groups or gatherings are likely to be associated with more transmission events. So whilst there is a long list, they don't reflect, some of them are more high risk, but others are low risk. And I just want to thank the cooperation of people. When we've asked people overnight to go and get tested, they've just dropped everything. Obviously we've asked them twice late, but they've gone and got tested. And that really assures us that we're locking down this transmission and tracking down any chains of transmission. Because what we've pleasingly seen is that this gentleman, apart from a close household member, does not appear to have transmitted anywhere else. And so again, I just appreciate that this gentleman got tested. If this person had not got tested, then we would have seen chains of transmission established. And that's what we're asking, some common sense from the community. We're just indicating that the risk level has gone up. We have these unknown chains. Please just respond as you have multiple times, and we will identify any undiagnosed, recognised chains of transmission, and our understanding of the risk level will change each day as we get more information.
Dr. Chan, clarification just about the transport network. Let's get a clarification. So the train network's currently running messages quite frequently saying the capacity has changed, please take up every available seat. With these restrictions, you're saying just wear a mask.
Correct.
That's correct.
People can still sit
Correct.
next to each other?
That's correct. So the mask provides a mitigation. So again, what we're trying to do is just reduce the risk of a really super spreading event. And so we're trying to minimise any impact and get that proportionality with the response. And mask wearing, the community has responded in the past with mask wearing incredibly high, like almost 99.9% on public transport. So we know that the community will respond to these calls, and I just want to thank the community for their response and their common sense approach.
Dr. Chan, these restrictions are in place until the 10th Monday. What needs to happen for you to be confident that you can lift these? I mean, do we need to see 0 cases over the next few days? Are you comfortable with a certain level?
So at the moment, the critical things that we're doing today is looking at sources for this individual, because once I can establish that the sources for this individual and find that missing link, that will assist us in understanding. Having said that, we sometimes never find a missing link, so what the community can do is come forward for testing, because if I have assurance that the testing rates are high and we haven't got any other cases, that gives me great assurance in saying that regardless, the trains of transmission have extinguished. One of the really challenging issues with COVID is that 75% of people don't actually transmit and 25% of people do. And so there is an uncertainty about the small number that will actually effectively transmit and lead to those super spreading events. So what we're trying to do is a bit like a bushfire. We're trying to reduce the opportunity for a super spreading event, which will be harder for us to bring under control by those simple measures of just wearing masks. And I think the community has responded to mask wearing in the past, and I think it'll be an important thing. We've kept it indoors, so again, it's proportionate.
Just in terms of nursing homes, obviously it is Mother's Day, you've restricted visitors to 2. Are people still allowed to take their loved ones, their mothers, out of their nursing homes? And do you recommend masks? You know, what's your advice to...
So again, the same application would happen. We'd really recommend that people preference outdoor environments. We've always done that. So if you're taking your mother out, sitting outdoors in cafes and restaurants, and also gardens and other environments outdoors. But clearly we want to make sure that we have the minimum impact on aged care residents but keep them safe. And so again, the people taking them out would still be required to wear masks and take all of those measures.
Is there anyone that works at the Fratelli Fresh or Bondi Trattoria that lives in the Marrickville area in that category?
We've just identified... It is an appropriate question, and this is the good detective work that our people will be doing, so you're ahead of the game. But what we've just done is we've obviously also cross-checking the people at that against anyone who might be working in the quarantine or other system and border system. So again, using that intelligence, but part of it will be also particularly interesting if anyone does reside in the Marrickville area. At this stage, I don't know, but obviously they're the sort of thinking that we apply to try and narrow down the source of the investigation. But I would urge everyone can help us by anyone at those premises to please go out promptly and get tested, because that will certainly assure us that those venues are not the source, and also track down any chains of transmission in the event that anyone was positive at those venues. We're also doing that upstream, more intensive investigation. And can I just explain that the cooperation of individuals in our investigations is actually quite onerous. We often require them to undergo multiple tests, we require them to go blood tests, we require them to be interviewed several times, check their records. And so I think we really should be very grateful to the response of individuals that cooperate, because the depth of information they provide, their cooperation with getting repeat tests, help us get the best advice to government about the level of risk. So again, just thank you so much to those individuals and the contacts and everyone who's gone out promptly and got tested.
One more question at a time, please.
You
Yeah.
mentioned the other state premiers in some of your comments. Have you had any contact with them, and do you fear they will shut borders?
Oh, look, this is, we are not shutting down anything in New South Wales, so any other Premier shouldn't even think about that. Absolutely not. But can I please make this point again and very clearly? It is business as usual for all of us over the next 3 days in Greater Sydney. But we are asking people just to take extra precautions. If you have a booking for Mother's Day, go to the booking, go to the restaurant. If you have a family gathering at home, that's great, but just limit it to 20 people. And if you are using public transport to go to a footy match or another event, please wear a mask on public transport. We're not affecting numbers or density or anything like that in any outdoor setting or any public transport or any restaurant or catering facility or anything like that. But all we're saying to people is we know that at least one person has been going around Greater Sydney with the virus. We don't know who they are. We don't know who they've been in contact with. We don't know where they've visited. So as a precaution, we're just asking everybody to use their common sense, wear masks when they're going shopping, wear masks if you're in an indoor setting, and just be safe. And this is a very measured, proportionate response to the risk around us, and we just want to make sure that we don't miss any cases, or else we haven't missed any trains of transmission, or else we make sure that everybody who may have been exposed to the virus has been tested and is at home isolating.
These measures are enforceable from 5 p.m. today, including masks on public transport. So would you expect people to get fined for not wearing a mask on public transport from 5 p.m. today? And if so, what happens to someone who's gone to work today on the bus, didn't bring a mask, finishes after 5 o'clock?
We appreciate that for some people they will have to go out of their way and get a mask. Most workplaces have them. Most shops have them. It's pretty accessible. We're in the middle of a pandemic. I think people will work it out.
Answer your question, please. And Mr. Hazard, can I ask quickly, Canterbury Hospital,
I'm sorry.
a letter written by and signed by 60 doctors about conditions there being called third world. What's your response?
Look, the entire health system has been renewed because of a $10 billion commitment from Treasury, and work has been done at Canterbury Hospital, but obviously each hospital is prioritised by its local health district. I know the local health district is looking at the issues at Canterbury, and I'm waiting for further advice from the local health district in that regard.
Have you been able to meet with those doctors or talk to them since?
I visited Canterbury Hospital. To be honest, Liz, I just can't remember when now because of the COVID issues occupying my mind, but I did visit it and I have had a look, and I'm very aware of the issues they're talking about. I must say the doctors over there are doing a very good job, as are the medical staff, but it's a very busy area, it's a growing area, and I've certainly indicated to Health that I'd like New South Wales Health to look at what can be done. But of course, the priority at the moment in terms of the infrastructure allocation, it's a huge infrastructure allocation, $10 billion, is the new $1.3 billion Bankstown Hospital, and of course $750 million going into RPA, and both of those areas serve it. But I'm very aware of the issue, and as I said, visited the hospital and talking to Health about what might be possible within the usual budgetary constraints.
Treasurer Perrottet's in 14 days isolation. Perhaps a question to the Premier. The Treasurer is in isolation, obviously as a close contact. He says he tried to scan his QR code at districts.
We won't. The Premier won't comment, and I won't comment, and nobody from Health will comment on individuals' QR codes.
But is that something that people have reported to you, that sometimes a QR code isn't registering, or is that?
Oh, look, there are a whole range of reasons why it might not, but I don't know the details, but we never comment on QR codes and individuals. What I will say again is it's so important that we be positive about individuals who come forward. Just imagine, I mean, if some of the comments that I've heard today regarding the couple were to become the way we thought about people coming forward and being tested, people won't come forward. So I would encourage the media, particularly, because you're the responsible section of the outreach to the community, to make sure the message goes out very strongly that that people understand. I was being serious. Liz, please. I would encourage all of the community to realise there could be any one of us next time that might have the virus. Don't go making critical comments about people who've done the right thing. And next time we'll know that members of the community will come forward. But if you start being critical of people unduly, then people will stop coming forward. The one thing that's worked so well, as Dr. Chancher said, I think it was somebody over here asked, Charlotte asked, what's the difference? What difference will there be next Monday? Well, next Monday, if people come forward and get tested, and we empower, as a community, we empower Dr. Chant and her team with the information about testing, then it may be reviewed and may be changed. But if we don't get out there and get tested, if we have any symptoms at all, then we're not doing what we should be doing as a community. And with that, thank you, but I won't be commenting, and no one will be commenting on individual QR codes ever. Thank you.
If you find the missing link by Monday?
As I said, we've given all the information we need to, and I admire your enthusiasm, James, but I think we've answered all those questions. Thank you.
Thanks, everybody.